Hello there, my name is Nathan Tobias, a medical student at KCMU Core. Today's topic is about BPH. BPH is the most common benign tumor in men, and its incidence is age-related, meaning that it increases with age. Histologic prevalence of BPH in autopsy study was done, and more than 90% of men with age more than 80 years had BPH. 50% of men with age between 51 to 60 had BPH, and 20% of men with age between 41 to 50 had BPH. As you can see, BPH increases with age. The clinical evidence of the disease occurs less commonly, and the obstructive symptoms are age-related. This is a picture which shows different views of the prostate. This one shows the lateral view before it has been cut. This one shows the cut lateral view, which gives us a sagittal view. And this one is a transsectional view of the prostate. As you can see, it has been divided into different zones. There is a transitional zone whereby most of the BPH comes from, and there is a peripheral zone whereby most of the prostate cancer arises, and there is a central zone. Here in between, at the middle, that is your urethra. Risk factors are poorly understood. Some studies found that it has genetic predisposition, racial differences, and 50% of men under the age of 60 years undergoing surgery for BPH had or have a heritable form of the disease, which is autosomal dominant heredity. First-degree relatives of such patients carry an increased relative risk of fourfold. Etiology also is not completely understood, but it has been seen to be a multifactorial disorder and endocrine controlled. Prostate is composed of both stromal and epithelial components or elements, and each element can give rise to hyperplastic nodules and symptoms associated with BPH. And BPH is found to be an imbalance between cellular division, proliferation, and cellular apoptosis. So there is a more number of cells which are being born, and less number of cells are dying, so which results into an increased size of the prostate. Each element may be targeted in medical management schemes, and BPH is under influence of testosterone hormone. The pathology is that the BPH develops in transitional zone of the prostate, and the hyperplastic process results in increase in number of cells and the size of the prostate. Microscopic studies reveals that the growth is composed of varying amounts of stroma, such as collagen and smooth muscles and epithelium. Mhm. Uh, if the stromal cell is composed of more smooth muscles, this person will benefit more in alpha antagonist together with 5-alpha reductase inhibitors. If a patient uses 5-alpha reductase inhibitors, it leads to results to a shrinking of the prostate and decrease in size, because 5-alpha reductase inhibitor inhibits the enzyme 5-alpha reductase, which is responsible for converting testosterone into its potent form, which is the dihydrotestosterone. This dihydrotestosterone results in an increase in the size of the prostate. The alpha antagonist, they block the autonomic nerve stimulation of the prostatic urethra. Um, the clinical findings have been divided into two parts. There is obstructive symptoms, which is due to increase in prostate size. There is a hesitancy, double voiding, sensation of incomplete bladder emptying, decrease in force and the caliber of the stream, straining to urinate, meaning use much energy to force the urine out, and the post-void dribbling. Irritative symptoms, these are due to secondary changes of the bladder, due to increase in urine outlet resistance, and it includes urgency, frequency, and nocturia. Might find someone is urinating more than 6 times a day and more than maybe 2 times a night. Investigations include the baseline investigation, is the lab investigation such as full blood picture, urinalysis, renal function test, prostate specific antigen. Also, imaging study are very important. Intravenous pyrogram, kidney urinary ureters and the bladder ultrasound, KUB, and the cystoscopy. The American Urology Association, they came up with a validated tool to evaluate patient symptoms before initiating therapy, and that tool is called the International Prostate Symptom Score, IPSS. The IPSS is composed of 7 symptoms or 7 items that the patient is asked to quantify the severity of their symptoms on a scale of 0 to 5. After that, they classified the symptoms based on severity. Mild is from a score of 0 to 7, moderate is 8 to 19, and severe is 20 to 35. And the score will predict what kind of treatment a person should receive. This one is the picture of that tool, how it looks like. These are the 7 components, and these are their score on the scale of 0 to 5. So someone maybe score 2 year, 3 year, 2 year, and 1 year, maybe 5 year. They add and get a score. The treatment, the treatment include watchful waiting for those with mild symptoms. It includes education about the disease, not to drink coffee before sleeping, and not to drink water before bedtime to decrease the urinary frequency, decrease the amount of urine produced during the night. Also, there is medical therapy such as alpha blockers, samsulosine and plazosine, 5-alpha reductase inhibitors. There is also surgery at KSMC. You will see frequently you will see TURPs, transurethral resection of the prostate. Transurethral incision of the prostate is not common, and open simple prostatectomy not common. There is also a minimal invasive therapy, which are not done. Then I've not seen these kind of therapy in our settings. Laser therapy, transurethral electrovaporization of the prostate, and hyperthermia. The differentials includes prostate cancer, bladder tumor, urethral stricture, and neurogenic bladder. These differentials or these diseases also, they may present with bladder outlet obstruction. So you must rule them out first. And this is my reference, and thank you for watching. If you have not subscribed, please subscribe to my channel, and have a nice day.